Hey guys, my name is Lexi and I am doing my disease report for Dr. Cody's microbiology class over MRSA slash visa slash versa. Let's get started. First of all, what is it? So MRSA is actually a methicillin-resistant Staphylococcus aureus, and visa is vancomycin intermediate Staphylococcus aureus. Versa is vancomycin-resistant Staphylococcus aureus. So what we're dealing with is the infectious agent of Staphylococcus aureus, and it's just about antibiotic resistant form of this strain. This is the taxonomy of it: the kingdom Bacteria, the phylum Firmicutes, the class Cocci, the order Bacillus, the family, the genus Staphylococcus, and the species Aureus. Some of the characteristics include it's gram-positive, it's cocci-shaped, it forms in clusters or in diplococci, it's immobile, it is a facultative anaerobe, and it's also catalase positive. So the history and the outbreaks. So the discovery of the bacteria itself was in 1880 in Scotland, and a surgeon was removing an abscess and actually found the bacteria. And then an important part of history was when penicillin was created in 1928. When the penicillin was created, it was used for a lot of different infections in order to combat them, and it was very helpful, very useful. But it actually wasn't used to treat staph until 1940s, so almost 60 years after staph was discovered. And then that created the first wave of outbreak in 1940s with the penicillin-resistant staph. And it actually became a pandemic in the 1950s, 1960s, because penicillin was what they had, and now this infection wasn't able to be combated with that antibiotic. Well, then methicillin was introduced in 1959, and that ended the first wave of outbreak. But shortly after, in 1960, 1961, when the first case of methicillin-resistant staph, which is what we're talking about, was discovered, and that began the second wave. And the second wave actually lasted through the 1980s because it took doctors almost 20 years to figure out how it was resistant, and it's because the strain had evolved to where it was mediated by, the resistance was mediated by a gene, MRSA, which encoded for the production of penicillin-binding proteins, PBP2A, which doesn't allow for the binding of the beta-lactams that is part of the methicillin. And the beta-lactams actually exert antimicrobial activity by not allowing the bacterial cell walls to synthesize, and without those beta-lactams, they can't break down the cell wall, and the cell becomes resistant to the bacteria. And so the third wave actually began in the 1970s or the 1980s, when they started using vancomycin in order to combat this MRSA, but that wave is actually still ongoing because now they have vancomycin-resistant staph, and there's just so many different strains that are continuing to grow. Like the penicillin strain actually has a ton more strains based off of it because they're not using penicillin to combat it anymore, but it's still changing and it's still growing. And the same with MRSA and the versa. It can be transmitted from animal to human, which is zoonotic. So if a human touches, it can also be transmitted human to animal, which is reverse zoonotic. So if a human touches an animal, they can become colonized or infected, and then they can go and another human can touch them and become colonized or infected. Actually, 1 in 3 people have staph in their nose and are unaffected, and actually 2 in 100 people are carriers of staph, and they just don't know. And obviously you can do it from person-to-person contact as well as contact through objects. So things such as your razor, your towel, things like that can be colonized with staph and you don't know it. And if you touch it onto an open wound, which is actually how the infection is able to be spread, is through a breach in the skin, so an abrasion, a rash, a cut, or a puncture. So if you have a towel that's infected with staph, like, and you touch it onto a wound, you're going to get infected because you just allowed it to have an entry point. As well as if you cut yourself shaving, you have a razor, that's allowing it to have another breach in the skin and a way to get in and cause an infection. So, but the symptoms of a skin infection are, it can appear red, it can appear swollen, it's going to be very painful and warm to the touch, full of pus or like other drainage, also accompanied by a fever. So this picture here is a pretty common rash that comes up with the staph, an appearance of what it looks like. Over here you see that this person got staph in their eye and it actually caused cellulitis, so it caused the eyelid to expand and keep growing and swelling. The way that they treated that, well, we'll talk about that later. So the diagnosis, in order to be diagnosed with MRSA, you actually have to go to a doctor. It has to be a licensed physician, and they have to take a tissue sample or a nasal secretion and allow it to grow on an agar plate. And they'll actually use the methods of the Kirby Bauer method, for specific drug resistance. That's what they're going to look for. But these tests can take up to 48 hours, and that is not very quick for an infection like this, because this infection can get worse, and if you've already waited a while, it can get into your bloodstream and travel to your organs, into your brain, into your heart, into your lungs, which could be very detrimental. But this is an example of the Kirby Bauer method. So back to the treatment. So the picture before with the swollen eye, one of the ways that they treated that was they treated it by creating an incision to drain it. And after using the incision to drain it and keeping the wound clean, it actually was able to get rid of the staph and to get his eye back to normal. And as far as I know, there was not any long-lasting effects to him. But after the Kirby Bauer method has been performed on the tissue sample, they will determine which drugs it is resistant to and determine which ones to use to combat the infection. You can also use antimicrobial coverage. I think they make like creams and stuff that you can use to put on it. But most likely they're going to try and, if it's bad enough, use an incision and drainage, especially for the skin. But if it's in your blood or if it's in your organs, they're going to use an antibiotic to help combat it. For vaccines, there's currently none available to my knowledge. It's because they have vaccines that they want to try that are antibody-based. However, the antibodies in them are not approved. The vaccines themselves are not approved for humans because they're not sure that it'll produce the outcome that they want. That's because the antibodies that they're using and the things that they're inhibiting are done by your body naturally. And if they're not really sure what the outcome will be if they add more antibodies into your system, so they've not been yet approved for humans. The populations that are at risk are anybody who's been hospitalized, works in hospitals, so doctors and nurses, has a medical procedure such as like a surgery or needs a catheter, gets an IV, that all opens like portals in your skin and allows for the infection to grow. If you're infected with HIV, you actually have a higher risk because as the disease progresses, you have a deficient amount of T helper cells, which actually help to combat MRSA. If you live in crowded living conditions or have poor hygiene, the crowded living conditions, like such as a prison or jail, you're so close to so many people and you have to have direct contact with these people every day, and it's not necessarily the cleanest place. Like, you're obviously at a higher risk. Participating in contact sports, just because you are so close to people that might have a cut, might be a carrier, all of these things, and you're at greater risk for getting it. Using intravenous drugs, because typically people who use drugs don't have the cleanest needles and they're opening a portal into their skin and allowing that bacteria an entry point. Things that you can do to prevent it are maintaining good hygiene. So washing your hands, making sure that you shower regularly, and if you get a cut, don't just let it sit there and air out. Like, You need to keep the wound clean and keep it covered in order to prevent anything from entering into the wound or allowing other people to touch it and get an infection as well. That being said, if you are dressing someone's wound or your own wound, make sure that you put gloves on and make sure that you wash your hands or use hand sanitizer afterwards. Lastly, don't share personal items such as the towels or razors as we discussed earlier. These are my citations. Thank you for watching, and if you have questions, I look forward to answering them in class.